The Medicare Advantage plans, how they're regulated is they're not standardized by the federal government like Medicare and supplemental insurance is. It just means that there are individual companies that make their own guidelines, and they all have referrals, they all have networks, they all have different co-pays. So when you get on an Advantage plan, it could be a little bit overwhelming because from company to company, it's different. Different guidelines, different standards, different regulations that don't have to go by through any federal regulations to make changes even. And that's what's a little bit nerve-wracking, is that change is pretty constant with those Advantage plans. So it's completely different than a standardized Medicare program or a standardized Medicare supplement. The doctors change, the network change, the hospital change, the guidelines change, and they change frequently. And so you have to really be aware of that before you get on anything like that. I call them Medicare disadvantage plans because I think it's a huge disadvantage for anybody that is in a situation where they need help. They have a certain specialist that can give it to them, but that specialist is not in the network, or they have limitations as far as driving or getting places. They have children that are helping them with their schedule to get them to the doctors. And it's a big disadvantage because the only specialist possibly that they can get, this just happened recently to somebody, was 60 miles away. And you know, the daughter works full time, and every time that she takes off, it's 2 hours just to and from, not to mention getting there and how long it takes. And so that's a huge disadvantage. It's a disadvantage because you cannot budget in what you're going to be out of. When you're on a fixed income, I know my mom only made $780 a month when she was here on earth, and that was a very difficult thing to navigate around as far as finances. And when you're having a lot of unexpected expenses coming in because there's co-pays and excess charges, that's a huge disadvantage to your pocketbook. And I think it's disadvantage to you mentally as far as emotionally when you're trying to navigate through an illness or a sickness and you're overwhelmed with that. And then on top of that, you have compounded the financial burden. That's a huge disadvantage. And I just think all the way around that when we have anything that comes up in our health, the biggest advantage we can have is to have the freedom to go to the best anywhere we want, not have to worry about referrals, and not have to worry about the burden of the aftermath, even if you are recovered and healthy, of the financial burden. So that's a disadvantage to me. The very first thing that anybody should consider, are you willing to have the risk of huge out-of-pocket expenses? That's the first thing. So on out-of-pocket expenses with Medicare Advantage plans, first of all, there's an in-network and out-of-network. And if you go out-of-network and you have an HMO or something to that effect, where you have a specific network of hospitals and doctors, you're going to pay all the expenses, okay? But they have percentages. You still have to pay 20% of your chemo, your medical durable, your oxygen, your diabetic supplies. There's all of those expenses. Then they have the out-of-pocket expenses of co-pays, where you have a payment that you pay when you go to the doctor, maybe $20 and maybe $45 for the specialist, or $75 or $50 for the emergency room, or $200 or $250 a day while you're in the hospital. There's a lot of expenses. And I always compare it like this. It's amazing how you can go to the grocery store and you're just going in to pick up a gallon of milk, and you think, oh, well, I'm here, I'll pick up these things. And you get to the register and they go, that would be $102. And you're thinking, how did I spend $102? I was just buying a couple of things. Well, it adds up like that with these Advantage plans. It's like $20 here, $200 here. I just talked to somebody last week, and he had only been on his Advantage plan for 2 months. And he came off of a Medicare supplement thinking he could save money. And in 2 months, he spent more than he would have his two premiums, the 2-month premiums with his Medicare supplement, because he had a PET scan from a follow-up from cancer and a simple little procedure, and it just took him that long to realize, I made a mistake. Immediately called, get me back on my supplement. So the out-of-pocket expenses add up pretty quickly, and over a course of time, you end up spending an absorbent amount of money. Free is never free. I mean, when they say free, you always have to think, and especially when we're talking about in the middle of a situation economically in this world today, nothing is free. Car insurance is not free. Homeowners insurance is not free. Health insurance is not free. And certainly Medicare insurance, where it's the most intensive claims in the United States, is not going to be free. And I think if we really stop and think about that, there is going to be a cost that you pay. And the cost a lot of times comes down very heavy on people's health, not getting the treatment, and then their pocketbook being financially devastated.